يا من صليت بكل الأنبياء
Assalamu alaikum.
يا
Thank you
من
very
في
much for the
قلبك
intro.
رحمة.
Okay. I'm a paper and pen kind of person, so I've got my notes here, and hopefully you guys will be able to see everything here. Um, I'm going to start, and you'll tell me the questions later. So why family therapy? I work in children's mental health, and the point of the family therapy is really the thing I talk most about with people that I train is not pathologize the child. Because when the child is coming in, child or adolescent are coming in, it's mostly about this is the person, he or she have got the problem, fix my kid for me. And that's not what works. Because if you end up working with the child or adolescent on their own, they're going to be coming back. It's not going to sustain. So family therapy is the important piece to do that we promote in children's mental health. Okay, so let's just get on to, okay. I usually have, no? How do we go back again? Yeah. Sorry. Okay, here we go. All right. No, I think I got it now. There we go. This one, oh, okay, yeah, thanks. So working with families is treating the context of the problem alongside with the actual problem. So if I get a family coming in and I start asking the parents, why are you here today? They end up complaining about the child right in front of the child or adolescent, and I lose the child or adolescent. Because what happens is it becomes very negative, things start to go down, people start to fight, and the young person just starts to disappear. I don't go there. So we're going to treat the child within the context of the whole family, and that's why we don't even start there. The symptom might be an indication for change in the family system. So the child is coming in with certain symptoms that the parents are usually more often emotional and behavioral issues. So I want to know who this family is. I want to build a therapeutic alliance and speak to everyone in the family. So Minuchin himself basically taught that the presenting problem was always the wrong problem. If they knew what the problem was, they would have figured it out themselves. They know that this kid is causing them a problem, and that's why they're coming in, and that's who they identify. Okay, not everything works. Okay, so we want to understand the interactional patterns in the family systems and reach beyond the nuclear family. And go into the family of origin. I usually try to understand 3 generations within the family within the assessment process. And the important reason for that is like if I have a parent, like the father who's struggling with adolescent son, maybe in fact have had issues with his own father, for example. Is the volume okay? Do I need to like glue on? Yeah? Okay. Yeah, is that okay? Oh, I guess I got to get really close. Sorry. Yeah. So families need to change to accommodate the different developmental stages. So I always say to the therapist, be aware of what stage people are at. If you have a young family coming in with 2 or 3 little kids that are 6 and under, they're in the beginning stages. They're figuring things out. Where are they in their careers? Where are they in their own development as parents? Who do they have as support? So you need to know the different developmental stages of its members to really accommodate and understand. So, so the main systems idea in family therapy is that process becomes more important than the content. So what's going on in front of you? It's not just about the information they're giving you. So the 4 main principles in how families operate is to keep in mind. Families are the primary influences in our lives. We learn everything from our families. And regardless if it's an adoptive family, an extended family, or a nuclear family. The family of origin is the first system with which we interact. So we learn how to do things by observing and living and experiencing them, the family, and we learn our sense of self. Our sense of self develops as a result of these experiences. So history tends to repeat itself, not just in the world, but even within our own families. So families tend to repeat in the present what's happened in the past, not necessarily consciously. You'll hear later on we talk about patterns and binds, etc. But it's not necessarily a conscious thing, but parents do what they know, which is what they experienced. So that's where you'll see the repeat. Without even realizing it, they start to do what what they experience with their own parents. I had a father come in once who was devastated because he had hit his child. And he said to me, I swore I would never touch my children because my father used to beat me all the time. And so I just looked at him and I said, well, you don't know any other way. I'm impressed that you've been able to be this long without hitting your children, because you grew up with that's the way that things worked and this is how things were done. And that's what's imprinted on your brain. You know, the sense of shame and sadness he came in with, but he was trying so hard not to do what his own parents did for him because it was very, very traumatizing to him. So we need to be careful with how we speak of these issues, and we'll get to know the whole family, with the whole, with the 3 generation. So everyone comes in as carrying a heavy load of baggage, unconsciously let certain issues, themes, and patterns dominate aspects of their lives. And that's part of the process of the assessment, is we're unpacking that. We're bringing from the unconscious into the conscious of what we're doing, how they function. Families move through time on a horizontal as well as a vertical continuum. The developmental life cycle, those are important to keep in mind. Symptoms are illustrative of the family's difficulties in negotiating a phase. And then we're looking at the 3 generations. So when I meet with a family, I want to know about the parents' own history. I'll start by asking the children, what do you know about your parents? Where did they grow up? Is your mom or dad the youngest or the oldest? Who did they get along with? Where are their parents? Do we have a support system available here or not? What are your relationships with all of them? And then, of course, what's happening within the nuclear family as they're there. So when I say family therapy, I'm inviting the whole family to sit in the room. I know that many speak of the idea of, well, you can see the parents and then you can see the children. And, you know, it's family therapy if you're seeing different individual family members. But no, I don't advocate for that. I advocate for the whole family to be present. And we'll keep talking about that so you understand what I mean. So each family member maintains both a separateness and a connectedness to the family. So there's always a struggle at certain life stages in the development of the young person about when to separate and how to separate. And I don't mean separate by leaving the house. The separation is the separation of the individual and understanding who they are within their own individual selves. So there's always the closeness and the distance are 2 points on the continuum. How do I figure out who I am on my own and in connection to my family? So we're keeping all of this in mind as we're working with the family. Okay. So symptoms can form in any of the 3 areas of the family. And we call it a symptom is because it's not necessarily just the behavior of the child that's coming in. The symptom can be between the spouses, which we will discover sometimes in the family therapy, and sometimes when in one of the parents with family of origin history and issues, and with one or more of the children and their parents. So is there a dyadic issue, conflict happening within the family? Now, often you hear about triangulation. So if there's something going on with the parents, sometimes the child's behavior serves to alleviate some of that conflict, and that's when we call that might be a triangulation between the child and the parents at that point. It's a tension relieving to involve a third party when we're in conflict or some form of upset. So that's the thing to look for. And sometimes it might be a parent with 2 siblings. Think of doing that earlier. Okay. We're moving. All right, so 4 goals in the assessment process. And when I was talking about I bring the whole family in, I join and engage with every member of the family within the first session. 1 second. Did we skip around? No, okay. So, and I try to do it with as much detail as possible. Now, it happens that I speak very briefly to one parent because I really want to get the parent's family of origin history also. So if I end up not being able to get both parents in detail, I will acknowledge that at the end and say, I spoke to everybody except for dad today. And Dad, hopefully next time we're going to learn more about your family of origin so you don't neglect the fact that they were not spoken to. You acknowledge it as it's happening. So I join and engage with each member of the family. And then I define the presenting problem systemically. I want to get to know the family, to understand the relationships, and understand what the dynamics are. Now, sometimes, like early on in my career, I remember, and I see this a lot with younger therapists too, they'll sit and observe the family as they're yelling at each other, and they're thinking, well, I'm getting a sense of, how they function at home. But then you're gonna have a hard time bringing it back and gaining control over the session again. So that's not necessary to hear the fighting and whatnot. You want to give them a positive experience. You want to be able to actually help them experience having healthy conversations in the session with you. So as we're going into the assessment process, we're going to learn how to, you learn how to do that slowly. You connect the problem to 3-generational process. I'm a very visual person, so I end up doing a genogram as we're speaking. And I'm connecting the relationships between parents and their parents, even their grandparents, if they know that far back. Some people don't have a sense of it as much, especially with new immigrant families. They didn't grow up with the parents might not have grown up with their grandparents. Develop a treatment plan. So I'm a strong proponent of a formulation, which is the 4 Ps in family therapy. And the clearer your formulation is and understanding the contextual work of how of the presenting issues, the more effective your treatment plan will be. So the theoretical approach to treatment contributes relatively little to successful therapy. I know that everyone wants to, how do I do this? Give me a step-by-step way to move into this situation. And there are different theories. Now, if you ask me what theories I use, the theoretical approaches, it's going to be a combination. Doing this for 30 years, you've just taken a little bit of everything that works within the family. And when you're working with people, it's really hard to stick to a formula because everybody's different. Some people really need more practical types of approaches, but you still need to know them and understand what the patterns in their lives are in order to be able to speak to what their needs are. But the most potent predictors of positive treatment outcome are related to qualities of the therapist and the therapeutic relationship. So if that client sitting in front of you, that patient sitting in front of you feels heard and seen, you have a relationship and the work will be more effective. So the therapeutic relationship, the attunement, which we'll speak more of as we move forward, empathy, warmth, understanding, and acceptance. Those are the most important parts of being a therapist. You can't fake empathy and attunement and care. And if you do, they'll feel it. They will react, they will respond, they will not connect with you, and the work will not happen. So genuine interest and close attention are really hard to fake. So be careful of that. So within the assessment interview, there are 2 main sources of data: what people say, the content, and what they do, the process. So what we're seeing happening, how they respond, things they say and things they don't say. Another source of information is always our own reaction to the child and family. And that's really important to be attuned to, because if you're not, which you'll hear me say again, if you're not, for example, if you're struggling, if you have a bit of, if you're triggered by a certain member of the family, you're not going to be able to do effective work at that point. So you have to be able to find empathy for the client, a true, genuine empathy within you. And that's really important, because if you don't, the work's not going to happen. Like, I can be reactive to a certain parent and I'm thinking, I can't sit in this room with this person. I can't believe what they're saying. I'm being totally transparent. And it's really important to realize and be okay with that if you're having these feelings. But if I cannot find the empathy for this parent that I'm working with, we're not going to move. We're going to be stuck. So this is where learning their own story and their own family of origin experiences will help you get to that place, to understand where they're coming from and what this rigidity is, or this anger is, or whatever it is they're presenting with that you're having a really hard time getting through to. So we're getting into transgenerational patterns and how they actually come to happen. Excuse me. Myths are based on patterns of behavior and experiences in our family of origin that we reenact in our relationship, most intensely in our family of procreation. So when we say myths, that usually comes from patterns. When these patterns are unknowingly repeated in our families, because we just do what we know. And if you think about it, you have two adults coming together and they're both bringing in the ways of their own family of origin. So of course, there's always some negotiation happening between the couple, like who's going, we're doing it my way or your family's way, without even consciously realizing they're talking about their own families. So when these patterns are unknowingly repeated, they can cause tension and stress that surface as symptoms in the system itself. So when we have these patterns, we end up following along just in the same way that we grew up, and we don't think about it, we just do it. And if you ask why, most people won't be able to tell you, some people can say, well, that's the way my family did it, or that's what we did in my parents' home. Some just think, well, that's just the way we do it. That's just the way I did it. So the myths are based on patterns of behavior and experiences. So sometimes, and if you think within our own communities, like there are cultural ways and there are faith-based ways, and how to separate between the two, because people automatically start to assume that everything that was done in my family is a faith-based way, but no, sometimes it's a cultural way. And then how are we going to manage to adopt some of those ways in this third culture that we're living in here? So that's a bit of a challenge for many families that come in, and like parents that come in and say, I want you to tell my daughter she can't do this. I'm like, the parent, I can't tell your daughter she can't do this. We're going to do this together. We're going to talk about this. Well, you don't know what my daughter's doing, and this isn't in our faith, and this isn't in our culture. It's not my role. I'm very clear we're going to do this together, and we're going to all work together on this. And this is really important. So the myths give rise to the patterns, the myths of what is supposed to be and that we grew up with without realizing it. And then the rules and binds tend to reinforce these myths. The rules and binds that we do put together. Rules through the different developmental life stages, binds are mutually interactive. Sorry, give me a second. I'm going to just jump here for a second, looking for something. Okay. So when families are caught, so that the binds are mutually interactive between family members. So when families are caught in some of these binds, children have difficulty negotiating their own autonomy and established boundaries. So in these binds, there are lots of things occurring unconsciously in family relationships. So sometimes what you have to remember that rules and binds also protect the family boundaries, making family members feel safe. Because it's predictable. It's what I know. It's what we work together with. It's automatic. This is where sometimes the stuckness happens because we're not consciously aware of why we're doing these things. So what are the rules that parents and grandparents may have subconsciously inherited and continue to bring forward? For example, cultural versus faith-based is a big one. And it's something to keep in mind. And then how do you help your children or help the family work through that being present here in a non-Muslim country or society is really important to also keep in mind. See, I'm used to having an interactive session, so this huge standing up here thing is not my thing, so don't mind me. I'm going to leave lots of room for questions. Okay. So in family therapy, with everybody being in the room, we make explicit the implicit rules to understand the stuckness. So we're gently speaking to the family to learn, and I don't say what are the rules. I mean, you might occasionally say it, but as I'm speaking to them to learn how they do things and how they interact and how they respond to things, those things you glean from that type of information, what the rules might be, or what the process is in this particular family, or how they interact, or how they support each other, or how they hinder each other. So that's the important thing to be taking. So a lot of it is just observation on many levels. We always stay curious. Remember that. Like, when I'm working with new staff, it's always like, well, they said this and then I got stumped. Well, what is it about what you heard? Do you have any other questions? Well, I didn't know what they were talking about. So ask about it. Continue to stay curious. Keep unpacking as much as possible, because the more you observe, the more you learn, the more equipped you will be to working with this family. So you can't do that same kind of work with one person. So when you're talking to one person, you get only one perspective. So for example, in the agency, or even if I get a call from another therapist to say in my private practice, so, oh, I'd like to refer this family to you because of this, this, and that. That's one person's perspective. I might call to make the appointment, and that parent will go on and on telling me their perspective. But when I have everybody sitting in the room, I get to understand everybody's perspective. I get to understand everybody's experience, and that makes a difference. So it makes it much richer. This is why we need to bring the whole system in. So we look backwards at our family history, both consciously and unconsciously, to guide our vision of where we are now and where we're going. So if we understand where things were, and sometimes we also get lots of richness when you hear about family history. See, the other part of family history too is you need to learn what the family's life experience or journey has been. Like lots of new immigrant or refugee families, for example, I really emphasize on this. Learn what their lives were before the issue of why they needed to leave their country. What was happening in their lives then? The kids sitting in that room learn so much about their parents and their family history when they are sitting in that room and we're talking to the parents and learning about, and kids are listening, even if they're playing, even if they're kicking each other, they're listening, they're hearing, they're learning. It's so important to go into that space with them and to be able to take the parents back to that. Even if sometimes it's painful, it's important to have them hear it and then in a safe space to be able to check in with them afterwards. So it's a very, very enlightening and rich process as we're moving into working with them. So one family gives only, as I said earlier, a limited and distorted description of his or her family, intake usually with one parent. The multi-generational group is required to simultaneously describe and enact the complex system of past and present family events. So the interview or the session accumulates both symbolic, historic information in the here and now experiential process of the family. So as they're speaking in the room with you, they're enacting exactly how they all interact with each other, how they operate as a multi-generational group. The other thing when I speak multi-generational, of course, I'm speaking parents and their kids. But if there's another family member, if there's a grandparent that lives with them, I always invite them eventually to come in too. Even if they're not living with them, like sometimes I do sessions with a mother and her mother so that I can understand better, not because this way I can get the report from the mom about her own experience with her mother. But if I can experience that person and meet them, it gives me more insight and more information about how to move forward. I can bring in 3 generations, 4 generations together. We can do that. I've done where I can bring mother, daughter, mother, child, in young person, mother, grandmother, and great grandmother, just to get a sense of that line and how they interact with each other. I can bring dad in with his father or his parents. We can do all sorts of combinations as much as we can. So when we move into so when the family's together, there's automatic access to the family unconscious. So you start to experience them and they start to experience each other very differently. It's so fascinating how kids will respond, or even parents. Sometimes parents will say at the end of the session, I've never heard my child speak like that. And it's like, because, we ask them direct questions. We're relative strangers, but they do engage. And sometimes I've had kids say, why don't we talk like this at home? And then I have to normalize it. Not families don't talk like this at home. I'm a neutral person who's facilitating a conversation. So don't blame your parents, in other words, as much as possible. So health depends upon accessing and understanding the unconscious, which is the primary processes, and the conscious, which is the secondary processes, experiences in our families. So the primary processes are the activities of the unconscious. An example of this secondary is process thinking is expressed in consciousness, and filters are experienced to make the world more understandable. So without us even realizing, we're repeating patterns that we weren't aware of. There's an example that I was thinking of, this young man who took on his father's business as a garage owner, and how his experience of success was unconsciously, some people call polluted, but I would say almost limited by his own father's experience of success. So it just went to a certain point and he thought, well, that's it. This is the definition of success. And he was so limited by it, and he was frustrated and saying, I've reached it. I'm much younger than where my father was when he reached it. I've reached it. What do I do now? So he was such a sense of stuckness, but that's because that's all he experienced, the success, when he experienced his father's success. So then as we're moving forward, so the important piece here, and I always emphasize this, whoever controls the definition of the problem controls the therapy. So the parent is coming in and telling you, fix my kid. Deal with this behavior. It's unacceptable. It's disruptive to our family. And you get stuck talking about the behavior. I move away from the behavior as quickly as possible, and I stay clear of it as much as I can. Because you're shaming the young person when you're constantly talking about their behavior, and you're wondering what is going on in this family that this young person feels a need to behave like this. What are they trying to tell us? What are they struggling with that's going on in this family or in their life that is causing and precipitating this behavior? I think that's very important to keep in mind. So family therapist establishes hypothesis and formulation, which moves to clearer treatment goals, as I said earlier. And with the formulation, we usually work with the 4 Ps. These goals are created by defining the connection between the symptoms that they're bringing in and the system, and how to move forward given this connection. So the symptom of the child, the behavior, is the symptom of the system. So we have to figure out what's going on, but this child's behavior is what that is. These goals are created by defining the connection, as I said, and move forward given this connection. So if the family defines the problem, the therapeutic course will be hijacked, because the family's definition is what's maintaining the problem. It's keeping them stuck. And we have to be careful with that and move beyond that. And this is why they come in. I don't even ask them why they're here. I just get to know them right away. I start to get to know, sometimes more often than not, I start with the kids. If you have the youngest one, it's great to start with them because they are the least censored. They're more spontaneous. They have the inside scoop on more things than people realize. And, and they're fun. And their parents and the family is much more forgiving of the youngest child. So whatever they say, whatever family secrets they disclose, they let it go and they think it's cute and fun. They're not going to get them in trouble. So I think that's important to keep in mind. So when I go in there, I get to know them. And through the questions we ask, and as we get to know them, the process is very evident as to what's going on with the family. Becomes more evident. Let's see, how do I change this? So if the therapist gets pulled into the should about behavior, the family systems continue to persist with the same struggle for which they came in. So they'll try to come in every session and say, you won't believe what he did this time, or you won't believe what she did this time. I try to gloss over it and move on and say, let me check in with everybody first and see what we can do, what we can learn about everyone's week, what happened, etc. But but I usually have other ways. And you find eventually, after you meet the first time or two and not talk about the problem, they themselves come forward in a different way. They quit persisting on the behavior, or they persist much less on the behavior, which I think is really important. So if you keep going into the should, this leads to a linear discussion, which is problem solving. And when you're problem solving, you're not doing therapy. Okay, I think that's really important to remember. Instead of assessing the function of the behavior, we need to try to figure out what's the function of the behavior of this child. Let's not try to deal with not try to treat the behavior per se directly. So family therapists need to be aware of the function of the symptom and the purpose it serves within certain dynamics in the family. What is the emotional function of this behavior? So when we talk about the 4 Ps, I think you might have all, many people, and I know it is psychiatrists are trained in it, and social workers, I believe, are too in now at the Faculty of Social Work. But it's the predisposing, the precipitating, the perpetuating, and the protective. So these are usually around the family system. What's perpetuating this issue? And you're not asking them that. You're gleaning it through your questions and recognizing and realizing it. So they come in for psychotherapy, and it's there to relieve mental pain and suffering and produce healing. So we're trying to relieve the tension that's going on in the family and that's happening between everybody. So difference between statements and questions. If you find yourself doing too much psychoeducation, and I know psychiatrists need to do that to help people understand their diagnosis and to understand what's happening for them if they have a diagnosis. It's different when you're working with young kids that are coming in and understanding that. If you're doing too much psychoeducation, I stop myself and I go, okay, why am I doing this? Why am I going to this place? It feels easier for me because I'm explaining things rather than staying curious and helping them come to this realization through the questioning. Reflect it back to them and question. So I catch myself if I'm doing too much psychoeducation to understand where's my discomfort, what's happening here. I need to minimize the psychoeducation because it's lecturing, and people don't do well with being told what to do. They do better when you are talking about different positions, views, how to address something, and have a discussion to be working together on the situation. So the difference between statements and questions: statements set forth issues, positions, or views. You have to be careful with doing too much of that. The questions will call forth the issues, positions, or views, and that's so important. So I'll always, even if I'm doing supervision, I'll try to pose a question to the therapist to reflect on, why do you think that stuckness is happening? What's happening here? What's happening there? To point them out and help them come to the realization in the same way without us necessarily having to just direct them and point fingers at what needs to be done. So parent-child conflict is usually related to unmet attachment needs of parent and child. So this is kind of realizing what's happening with the two of them. An acting out adolescence is usually perceived as one who's struggling with an individual need for autonomy and a continuing need to be connected. So if you think about, they're like, I hate you, I hate you, I hate you. Will you drive me to the mall already? So, it's that kind of thing. I'm pushing you away, but I also need you. I'm always needing you. So just to keep that in mind. Ineffective responses to these attachment dilemmas, usually because as a result of parents responding only to the acting out, which is the anger, because it triggers often their own attachment need and experiences. Because they didn't have their needs met at this stage, they don't know how to meet it. And they feel frustrated. And you'll hear parents say it sometimes, and they'll say, well, when I was their age, I didn't dare say things like that. I didn't ask my parents for anything. I didn't do this. So it's like, why are you expecting this of me when I never got it? So even in that basic way of saying that, they're telling you, my own attachment need was unmet. So becomes sometimes a resentment about it. This creates a situation often where parents' approaches become more rigid and they get stuck by either attempting to control the situation or just withdrawing and saying, I don't need to be doing this. I never got this. Why should they get this? This, unfortunately, will lead more to conflict and impacts the family communication and connection, because then they start to withdraw and just get really angry. So the adult attachment security influences the ability to see the child's needs. So sometimes, and more often than not, we end up working more with the parents than we work with the kids, because the kids are going home to them. You know, even when you think of a child that comes in with suicidal ideation, I've had therapists that say, I need to help them, I need to do this because the parents do this to them. And I'm saying, this isn't your child. This is their child. You need to bring the parents in. You need to understand what's going on. This child is going home to them. These are the people that are going to keep this child safe. You need to be there as a support to them and understand them. And that is the most important thing to remember when you're working with young people. And young people up to the age of even 24, 25. And I'm not talking just 6, 7, 8-year-olds. And I think we talked, Dr. Sadia's mother was saying earlier, you know, that this is an issue here in the system, that after 18, you can't speak to the parents about what's going on with their child. And that's something that we have to find a way to work with everybody together. Okay, let's see, move on to here. So goals of relational work. And I think that's the most important piece of any kind of, even if I'm working with an individual in private practice, I want to know their history. I want to know their life experiences. Because who is this person? How did they come to be in this place and who they are and in this stage of their life? And I'll only learn that from when I get to know their whole family story and life experiences. So the work is very relational. And the goals of relational work is reflective functioning was one area of it. Understanding the internal experiences or unmet attachment needs, oftentimes the softer feelings that drive that behavior in both child and parent. And that's the important thing. So when you're asking a parent, what happened for you when? Often when I have somebody, they're going on about, you know, a 16 or a 15-year-old and they're in school and they're doing this and they're not doing that. I'd say, what were you like when you were their age? What was happening for you when you were 15? How did you do in school? Oh, well, I was more independent and I did this and I did that. That's amazing. So did you have a sibling that was stuck like this? Or what was happening? Who supported you to be that amazing when you were 15? Et cetera, et cetera. So, and is that parent able to be there for their child in the same way? How do you make sense of why she might act like that, or like your young person might act like that? What is your understanding? What do you think it's about? So just help them be curious as you're staying curious with them. Curiosity, which I use a lot in my training. Stay curious, don't stop, keep asking, stay engaged with them. Eventually moving toward parent asking questions of their children. Whatever we do, the parent models. So this is the important thing, the empathy you have for the parent, the way you are able to hear the parent, the way you're able to engage with the parent, the way you're able to join and build a therapeutic alliance with the parent is extremely important. You remove, with your ability to do that, you move away from shame. Shame is a huge piece, and parents tend to shame their children, not intentionally, but in the same way that they may have been shamed growing up, again, not intentionally. So what else went through? So eventually moving toward parent asking questions of their own children. What else went through your mind at that moment? What else were you feeling? I guess now I'm hearing the stuff called gentle parenting or whatever. I don't know. There's a new name for stuff all the time. But always remember when you're talking with parents and about the kids, the most important thing to remind them of, and I know it can't happen all the time. Life is busy. Life is so much going on. Remind the parent to connect with their child before correcting their child. Connection before correction. Because when you're correcting all the time, there's so much shame-based responses to it. And when you're correcting all the time, it's like kids say more often than not, I can never get anything right with them. I don't know which way to move and which way to go. So to try to connect, and sometimes I say, okay, if you can't connect in the moment of, escalation, try to remember to connect in the quieter times. And that's another thing. When families disappear on you, say, things are fine. That's the time to come in and do more work when things are fine. So we get to know you and talk about how to build on the strengths that you have. But remind parents that connecting is so important. So to connect before they correct. And I don't mean connect first and, stroke them and then you get them in trouble. No, the point is to remember to be connected with them as much as possible through it. So when we're talking about reflective functioning, to go back to the top, it's moving from the behavioral and the idea that the behavior is wrong and needs to be fixed. So that's the important thing to think about. Okay, where are we going now? So I think I might have alluded to this before. Sometimes parents need to experience the felt sense of attunement and being with them from the therapist first, before being able to be aware of their child's needs and attuned to their children. That's why we go to inquiries about how the parent experienced their own parents or their own childhoods or adolescence, because we do what we know and what we've experienced. It's like imprinted on us without realizing it. It doesn't matter. Sorry, I lost it. Oh, it's there. Okay. When parents feel attuned to by the therapist, their autonomic nervous system just calms and responses are calmed, and they're able to eventually do this for their kids. So you're modeling to them what you want them to be able to do. So if you can do this for them and help them experience a sense of being heard and seen, they can start to do the same for their children. Now, if you have a parent that has experienced extreme trauma, that's going to take a lot of work. And that's what you need to be aware of. It's not going to happen with just 1 or 2 sessions kind of thing. And I think that's important to realize and recognize. So it's about creating safety in the therapy, the non-judgmental experience. That's the important thing to keep thinking about. And having experienced a non-judgmental stance with the therapist, they can turn around and do the same with their children. So a lot of work with children and adolescents is working with the parents. Sometimes I will see the parents alone because they need their own space to let go of things. If you don't have both parents on the same page, you'll try to bring one parent in on their own to try to support them through the process. I think that's the important thing to remember. And more often than not in our consultations, I'll say, I'll do the parents if you want to do the rest of the sibling stuff, or if you want to work individually with the child to teach them or help them work through some of their own feelings and understanding of how to move forward. But it's so important to do the work with the parents, to support the parents to be able to be available to their kids, to support the parents to not feel judged and have a different experience than they have had in their own lives and what they're bringing into with their own families of procreation. And I think that's the thing to remember. I could go on and on, but I decided we have to stop here. And I look forward to hearing questions because I'm not used to standing up and giving a lecture. So